Dr. Blackstock, welcome to the show today. I'm so excited to have you after meeting you at Health and listening to you and reading all about you on LinkedIn and everywhere else. And this is just a true honor.
Thank you so much, Aaron. I'm excited that we found time to connect, and thank you for having me on your podcast.
Of course. Well, and the other exciting part is that this is the first episode of season 2 of the Reaching Higher podcast. So, welcoming in the new year, and I'm excited that it's you that gets to do this.
Thank you.
One of the things I like to do, though, is before we get started, everyone has a story, everyone has a journey, and so I'd like to start with your journey as a physician. What led you to a career in healthcare?
Yeah, the simple answer is my mother, the other Dr. Blacks, the original Dr. Blackstock. And so, just kind of amazing looking back on like being a little girl and having her as my role model. And, I share that she had a very different upbringing than I did. I live in Brooklyn, New York. I've lived here the majority of my life. It's actually where my mother was born too, probably about 15 minutes from where I am right now. And she just grew up under very different circumstances than I did. Public assistance. She had a single mom. There were six siblings. It was really, she had a really tough life, moving a lot, changing schools, not knowing where the next meal was going to come from. And to know that she went from that to becoming a physician and then like working in the same community that she grew up in and where she could have gone anywhere afterwards. She went to Harvard Med, Brooklyn College, then Harvard Med. She could have gone anywhere. It was like, I want to go back to my and just seeing like her dedication to the community really just inspired me when I was a little girl.
Well, I love that story. That's a great segue into our next question. You have a New York Times best-selling book called Legacy, and it beautifully honors your mother's work in Central Brooklyn. One, tell us a little bit more about the book, and then how do you feel your mother's quiet advocacy, which I think you're alluding to,
Yeah,
differs from the global platform you hold today?
yeah, that's a great question. But legacy, can I just tell you, I never thought if someone said, "Oh, you're gonna write a book. It's gonna be a memoir, and it's gonna be a New York Times bestseller," I would have said even like 4 years ago, I would have said you are totally joking. But I was doing my work around health equity, just which I just want to say is really about making sure that everyone has the best health outcomes, the best care, access to care, quality care. But I was doing that work, and I was in alignment in 2020, and I was on a local NPR radio show, and my literary agent heard me do a segment on COVID and racial health disparities. And she cold emailed me and said, I've been following you on social media. I just heard you on the radio. You have a story to tell, and you're the only person to tell that story. And so that was the beginning of Legacy. And Legacy essentially is a memoir, but the title has a double meaning. And, it's about being a second generation physician, Black woman physician, which is just something that is still quite rare. But also it's about the legacy of racism in medicine and society and how it impacts health outcomes and what we see today in terms of, even though we've had advances in innovation, technology, research, why do we still see these disparities and why they still exist?
Which I appreciate.
I didn't answer your final question about the quiet advocacy. So my mother, so even though she was doing this work on she didn't have the platform that I did.
Yep.
The work was still very, very impactful. Like I meet people today that were her colleagues, that were her patients, that say, "Your mother made a difference. Your mother listened to me." I think what I'm doing now is just really providing a platform to talk more about the kind of work that my mother and her colleagues were doing in the 80s and 90s when we weren't calling it health equity, right? We didn't have a term for it. But really what they were practicing was just what I call structurally competent, holistic care, thinking about the full person, not just what's happening in the exam room, but also what's happening on a community level. And so I think this opportunity now, which I am so deeply grateful for, on social media, speaking and being a contributor for news, but to really be able to spread the word and messages that she started.
Well, so she sounds brilliant, and we will actually touch on some of your community work because I think this is a theme I'm hearing regularly on the podcast that having a national platform is great, but being connected to community and really that's where you can start affecting change. And so we'll get into that in a minute. But I do love that you set me up with this sort of systemic racism. And I hadn't heard about this before, and so maybe you can expound on this. But you often discuss something called the Flexner Report and its role in closing black medical schools back in the early 1900s. I believe the report came out in 1910. So if those schools had remained open, how different would the current American healthcare landscape look today?
I have to say that that report was so monumental in that it actually also closed predominantly white schools, but there were so few historically black schools at the time that were educating black physicians, and black students were not being allowed to white medical schools. So it closed 5 or 7 of those medical schools, leaving behind Howard and McGarry, so leaving behind only 2. And so there was a report that came out in 2020 that said that if those 5 schools have remained open, they would have educated between 25,000 and 35,000 black physicians. And can I tell you, when I read that, I teared up. I cried because I thought of like what you just asked, like the impact and what the impact is. I think that there would be, because when you look at the data now, a lot of black physicians and other clinicians of color, they're more likely to work in underserved communities. So, I think it'd be more community-based care. I think that the research that we do would look a little bit different in terms of what is actually being studied. I think the pipeline of physicians and clinicians would also look different because you would have more black physicians to mentor younger students, right? That would be like the standard. So, like, there's so many different layers to it. I think about the patients that could have been cared for because we actually have data that shows racially concordant care with the clinician and the patient are the same race, especially for black patients. It actually makes a difference in terms of the outcomes. It shouldn't be. I mean, we want a system where it doesn't matter who's caring for you. You get great care and great outcomes. But unfortunately, it's not always the case.
Well, it's astounding thinking about that 25 to 35,000. And to your point, the bigger issue being, I'm going to guess that that's probably at least 4, if not 5 generations worth of, which to your point, the
Yeah.
bigger, more profound piece
Yeah.
is you are taking those mentors out. You're sort of, creating that skepticism in the system and creating massive issues. So thank you for bringing that to light. And I will actually link to that, the write-up about the Flexner Report and the ultimate harm that it did in the show notes. I do want to touch on something which probably feels a little bit like a no duh, but I think we were having these conversations more back in like the 2018 through, let's say, up through George Floyd, and then with some of the current, things that are going on with the administration, we've a little bit lost the signal on this one. But you've made a strong business case for health equity. How do you convince skeptical health system leaders that equity is a financial imperative, not just a moral one? Meaning, this can be good for everyone, whether you're a good person or not. Like, it's good for society. So tell us more
Yeah.
about that.
Yeah. So it's interesting because I feel like the conversations that we've had maybe over even the last 10 years around health equity, we could have had them in a different way. And I want to say, like, even in a more inclusive way, like, to say what is a bigger general impact, and not even just the business, but the general impact is thinking about the fact that I said earlier, really we just want great outcomes for everybody, right? Regardless of racial demographics, socioeconomic status, we want to make sure people have access to care, culturally responsive care. Like, this should not be something that is exceptional or in its own silo. I do think that we could have done a better job of talking about the business case because actually what we've seen, for my organization, the strategic consulting firm advancing health equity, and we saw what happened this past year, 2025. We're seeing organizations pivot as they are kind of figuring things out. But one of the requests that we're getting a lot of is I need, like, for leaders, I need to show my CEO, my boss, what is the ROI on these health equity pilot programs that we've stood up the last few years. So yes, we want to know in terms of patient outcomes, what is the benefit? Also, how has it impacted the cost of caring for patients? And actually, what we do see is that when we have health inequities, we actually spend more on care because people end up being sicker. We actually also see another piece of it is clinician burnout and well-being. So, because these are all systems issues, right? So that's another thing that these disparities lead to. We see that especially among clinicians of color, they're more likely to leave or change jobs, just not stay around. So there definitely is a cost to these health inequities. And I think that we have to think about how we frame it, that this is about quality care. This is about access to care. This is about making sure that we're taking good care of our clinicians and our patients. And yes, we want those patient outcomes, those KPIs on like 30-day readmissions to be ideal. We want those hemoglobin A1Cs to get lower. But we also want to say, hey, look, we actually, for example, we gave a stethoscope to our patients in this rural area or this area where we're having poor maternal health outcomes. And this one intervention not only saved lives, but it saved us money as well.
It's funny how simple like a solution can have such a major impact. And it is one of the things. I had a guy named Chuck Lavelle on the show last season, and he's the keyboardist for the Rolling Stones. He's a conservationist. And one of the things I asked him is, Chuck, what's one thing people could do to make a difference? He's like, pick up a piece of trash if you see it, advocate for green spaces. So I love your like give stethoscopes to people in rural areas that may not have access to, good healthcare or medicine. And, little simple things like that can go a long way. So I really appreciate
Yes.
that pragmatic answer. The next question I want to ask you, we'd be remiss if in 2026 we didn't mention AI. But I want to go in a direction that is I think not everyone's sort of keeping their eye on the ball on this one. So we see a massive surge in AI in healthcare, which inherently is a good thing. But what specific red flags should we be looking for to ensure these algorithms that are used by the large language models don't automate and scale existing racial biases?
Yeah, I feel like so there are a few things I want to say about AI. One is I do think that I think people understand that when with AI that if you have a biased data set or data set that is only looking at certain patient groups and then you're applying it to all patients, right? That could reinforce inequities. But also, if you have a data set that you're not really thinking intentionally about why does the data look the way it does? So you may know about the study. They wrote about it in Science a few years ago. There was a study that looked at this algorithm that hospitals and major insurers were using to allocate resources to patients with complex illnesses. And this algorithm, what it would do is it consistently gave fewer resources to Black patients than white patients. And the assumption was Black patients were not as sick because when they looked at the data set, they said, oh, Black patients they're only spent, this many resources are going to them, but this many more are going to white patients. But what they didn't recognize is that patients weren't able to access care. So they weren't utilizing the system. So we need software developers to really be thinking about, okay, if I do have a data set that is representative of the patient population, what are the other things I need to think about? Right? So that's one thing. I think the other thing is what we saw, and I wrote about this in my Time article that came out last year, thinking about I felt like as a 2025 broke the healthcare system. And one thing was looking at clinician well-being. And we're seeing a lot of burnout. And when there's burnout among clinicians, we also see sometimes biases coming out as well. But what's happening is they're using AI to supplement the clinician work. And I think we have to think about using AI in a very thoughtful way. Yes, maybe to help write notes, but we know that hopefully that will allow clinicians to spend time interfacing and with the patient, right? That's what we want. Because when you're at the computer just typing and not interacting with the patient, that's when these biases come a little bit more.
Yeah, and we forget how much the human touch also matters, right? And so the more sort of eyes on, face time, face to face you can do is critical. And since you mentioned it, I'm going to jump ahead and then we'll go back. But you did write a recent Time article. I think you wrote it actually last week, and it was called "The Dangers of RFK Jr.'s Unscientific Vaccine Schedule." In the article, you highlight that children from low-income families will pay the highest price for new unscientific vaccine policies. So this is back to that concept of community, which we'll also touch on again in another question. But what ways can community leaders best advocate for these
Yeah.
families and ensure health equity doesn't
Yeah.
further erode under these federal shifts?
And I got so lucky because that was actually my second Time article. So I had one that came out
Oh, okay. Wow.
December
That's awesome.
20, but looking back at 2025 health wise. And then, of course, I had to do one that was like even more timelier when we saw the change of the childhood vaccine schedule. But like, it's so interesting because even though I have this platform, I honestly do think that like the real work is done on a community level by the organizations in the community where people know them, people know the work that they do. And I think that it's interesting because I just had a conversation with a potential client about a particular vaccine was just in the last 2-3 years. It's now, and one of the conversations we were having was how can we form relationships? Well, wants to go and tell community members, I need you to take this. I need you to take this vaccine because it's going to protect you. I have to say, obviously, I'm a physician. I think vaccines are amazing. They've saved millions of lives worldwide. At the same time, we know that trust is huge. We know that when changes happen in policies that we saw a few weeks ago, it causes confusion. Not only confusion, but in a world where, in a country where trust is already eroding between people and institutions, it's going to erode even more, right? And so that's when we need community-based organizations. We need to have relationships with them to say, hey, can you talk about this vaccine in a language that community members can understand? Can you help us with the education piece? Can you help us with the access piece? And that is about going in at the time that you need them, about forming these relationships long before, long before. And I think that's the problem we had initially with the COVID vaccine. People were so worried, like this thing made so quickly. But I remember that what was important was we had to get community shops, churches, hair salons. Like we had to get those organizations involved because they're the ones that are closest to the community.
Yeah, and the ones that people trust. And it's funny, I did an interview the woman named Dr. Vanessa Carey yesterday, and her oh, did you? Well, so perfect that the two of you will be right by each other. You're gonna drop your episode will drop this week, and her episode's next week. But we're talking about climate change and its impact on healthcare, and how there are similarities between the conversation of not believing that climate change is a hoax, and that vaccine, obviously safety and advocacy is a big deal, but it is all about that. Who is the messenger? How do you communicate it? How do you build that trust? So I'm glad that you brought that up.
Yeah, and then like you said, the overlap between climate change and healthcare. Like we know that there are neighborhoods that are a few degrees warmer, and because they're a few degrees warmer, worse asthma rates, worse term labor, right? But it's like how do we make sure that the community understands that?
Yeah. Well, and speaking of community, so I'm glad that we are coming back around to this. So you've used grant funding from Black Voices for Black Justice Fund to partner with Brooklyn-based organizations like Ancient Song, which is a doula collective, and the Brooklyn Movement Center. So let's talk a little bit about this marriage, right, between national and community, and why is it vital for national health equity leaders to stay tethered to these specific local grass movements rather than just working at the corporate or policy level? I think we've hinted at it, but I'd love to get a more holistic answer.
So definitely trust based, but even more so when you look at what impacts health outcomes the most. So there's this pyramid that CDC years ago, but it's a pyramid that shows what has the biggest impact on health. The very tip of the pyramid, it's like the smallest impact. It's actually kind of the clinical interventions, like what we do as clinicians. And that's so humble. But what is at the bottom is what's happening on the neighborhood level, like systemically, right? Like in terms of education, employment, access to care, like what we call the social determinants of health. We know that depending on where you live, right, it could be two neighborhoods right next to each other because of the legacy of policies in this country, like redlining, there's a 20-year difference in life expectancy. And so that is why, even if we're doing the work on a national level, we need to get down so granular to the community level because that's where the biggest impact on health happens. And that's something that I didn't learn in medical school. That's something I
Well, I don't
learned
think you do.
after. Yeah.
Yeah, I mean, like that is the thing that you should learn, right? Everyone should learn more about that social determinants of health. I'm glad you brought it up. And for those listening, because it's not strictly a medical crowd, but it's this idea of your zip code actually has more to do with your health and longevity than even your code of DNA,
Right,
right? And like
right. Your
how
genetic
you're
code.
wired
Yes,
because of all the reasons you
yes,
mentioned.
yes.
So,
And so and to see that, and it's interesting because I have to explain to people, like, why does it depend on where you get an education or your job? When we look at neighborhoods where people are not able to purchase property, right, where they're not able, where the schools are underfunded, where their businesses don't go there, all impacts health, right? Because
yeah.
have employer-sponsored healthcare. People are living with air pollution. You know, there's so many. All of these factors come together synergistically.
Yeah. Fresh water,
Fresh
access to like
water,
good,
yes,
non-fast food. I
yes,
mean, not that fast
right,
food is
yeah,
horrible,
yeah,
but
yeah,
not for all your meals,
yeah.
right?
Listen, right? We order plenty of Chick-fil-A and McDonald's in my household.
I mean, kind of de rigueur, but I do have two more questions, then we'll get into some more lighthearted questions. So, one of them that I know you've sort of advocated for, and it's a big one on the health equity front, but maternal mortality for Black women, it's like it's despicable in this country. It remains a crisis, even for wealthy and famous people like Serena Williams, the tennis player that many people know. So, what is one policy change that could really move the needle on this overnight?
Yes, it's a good question. The one policy change is paid family leave because the majority of maternal health deaths happen postpartum, and a lot of it happens when people have to go back to work. They are not able to stay home. They're not able to like really be in tune with what's happening to them, and so that is one huge policy that we need.
Well, that sounds simple. I know easier said than done, but I love that impact, right? I don't think I would have thought like that's the thing that would change it,
Yes,
but
yes.
now that I think about it, it makes a ton of sense. And as a father of three kids and knowing what my
Oh,
wife went through,
yes,
um, that does make a lot of sense. So thank
yeah.
you for sharing that. So one last question, and this is something I'm really interested in because you have a light about you. So anyone that's watching this will see that. Anyone that's listening hopefully can hear it through your voice. But you do hard work, right? You do really hard work. And so the Reaching Higher podcast is about using your platform for change, which clearly you're doing. So in moments of burnout or political pushback, which I'm sure there's been plenty of both over the last several years between the pandemic and everything else
Yeah.
that's going on, what is the North Star that keeps you from stepping back?
Yeah, no, it's the families. It's the people that I meet every day in my community because actually I live almost in the same neighborhood that I grew up in, and it's the people who say like, "Oh, Dr. Blackstock, I saw you on air and I got vaccinated because of you," or I'm
Oh,
working with my or they say I sent my kids back to school during COVID because you sent your kids back.
I mean, talk about like an impact, right? Holy cow, I'm getting goose flesh just
No,
like
no,
hearing you
no.
say that.
And whenever I mention it, I'm tearing. You can't see, but I'm tearing up because what um, what an honor. But also how humbling, and also how like every word I say, if I'm on air or I think about, I talk for like 2 hours for a 3 minute segment because I know that I'm not talking to the host. I'm talking to families out there that I want to be safe. And I also think about the work that I do, ultimately, the impact that I want to make is I want people to be able to live long, full lives. When I think about, life expectancy gaps in this country, actually for all Americans, I think about it's like missed birthday parties, missed retirement parties, graduations, missed opportunities to be together with love and connection with people in your family and with friends. And so that is really what um, motivates me to continue to do this work.
What a beautiful answer. So thank you for sharing
Thank
that
you.
and being so honest about it, because I think that means a lot, and hopefully people can hear that emotion in your voice, and it's very touching, and I can only imagine what that impact feels like. And words do matter, right? I love that you take that seriously, where you say I'm prepping for 2 hours for 3 minutes. So now for some more lighthearted, well, mostly lighthearted questions. But one of the things that I like to help the audience with is, I know people are always looking for content that they want to consume. So talking to smart people that are doing good like you, a book, a podcast, a show currently that has your attention, ideally maybe something that's a little more on the frivolous side
Yeah,
versus the serious business book.
yeah. Actually, I'm watching this Netflix show called His and Hers. It's a limited
Mm,
series. Have you heard of it?
I have heard of it, yes.
Stories. I've seen all of them. This one is about this town outside of Atlanta, a rural town, and a strange couple, one's a detective and one's a journalist. They come back together to solve this murder of the woman's high school friend. So I'm really enjoying it.
All right. Well, I'm going to take that and put that on my list, because we're down to the one about once every like 3 to 5 months, I'll go on Facebook and ask for recommendations. I have people that tell me, they're like, I keep an eye on your Facebook, so when you do that, it gives me
Well,
recommendations. But
yeah,
this is
and
one I'm going to add.
it's this show is I think it's number 2 on Netflix, so everyone's watching it.
Oh, good to know. Well, that's going on my list. I just started watching one called Dave, which is a few years old. It's about the rapper Little Dicky, who's very funny. He's a Jewish, white guy, but
Yeah.
he interacts with all these like real rappers, that my, Meek Mills and, Young Thug, that my kids grew up listening to. And so it's like, oh, this is funny.
Yeah.
They have all these, rappers who are kind of a big deal. Gata. So that's a
So
fun
it's
one
on
too, if you're
Netflix.
looking for something. That one is on, I think it's on Hulu, but it's on a few different stations. But anyway, another little plug if people are looking for something fun. All right. So I know that you've met some very important people in your life. Out of all these amazing people, who has impressed you the most?
Oh my goodness. I forgot you were asking this question. It was a person I met recently that I was like, oh my God. Ava DuVernay, the director,
Ooh,
who,
yeah.
has made such fall movies like Selma. And I was at a convening where I was also speaking, she was speaking too. But just thinking about her artistic, when she was sharing her artistic process, it's really, I mean, it's even more fascinating than watching the content that she makes, but just hearing about what goes into developing these movies. So that was definitely a big moment for me.
Well, I love that you picked her. And so Selma obviously is a great movie. I remember 13th, which,
Yes,
was sort of
yes,
pushed hard after the George
yes,
Floyd and the
yes,
Juneteenth, and watching that, and a few of her
yes,
other movies.
yes.
So thank you for reminding us of one of the great ones, who I've never met, but seems like she's a great person. So thank you for sharing that. A little more on the serious front, but biggest regret.
Biggest regret. I think biggest regret is I did not leave my academic job sooner. I stayed because it was like safe and secure. Good titles and a good salary, but I was miserable and I wanted to do so much more. And so 10 years in when I decided to leave, I wish I left earlier. Um, but, it is what it is.
Well, and you're still young, and so obviously you still have plenty of impact that you can make. And I
Thank
think
you.
that's a good lesson to a lot of people, where people get stuck because of the money, or
Yes,
because it's like the
yes,
economy's not great. I don't want to like risk not finding another job.
right.
Your own sanity and happiness, I would say, really should trump those things. So that's a good
100%.
recommendation. All right, just two more. One of which is a band or artist, ideally one that's no longer around or no longer able to be seen touring, that you would most like to have seen.
I've seen. Okay, I saw. Okay,
You can have seen them, but maybe they're not touring. Like it could be Prince or someone like that. Where, are you kidding me? So I never got to see Prince, and he toured. One of his last dates was in Oakland, literally 15 minutes away from me. I was like, no, I'll have plenty of other opportunities to see him, and of course I didn't, which I'm really mad at myself for.
In Newark, like a few years before his passing, I think I listened to his music almost every day. Oh my goodness, like just seeing, just see amazing.
I love it. Well, obviously, I love it. I love it. So, well, we're mind melding for sure. So, last question, and I actually, because we didn't really drill down into advancing health equity, which is your company, and you reminded me of this. So, two parts. So, how can people engage, read you, help with the company advancing health equity, and maybe while we're talking about that, give a little bit more of like what does advancing health equity do, so that people who want to get involved can get really excited about it.
Like advancing health equity in 2019 really to help organizations in the healthcare ecosystem move from aspiration to action when it comes to thinking about equity. And it's not just in outcomes, but in leadership, strategy, operations. We work with like a wide variety of organizations, pharma, hospital systems, nonprofits, healthcare companies. And it's been interesting over the last year. We've had to sort of shift the work that we do. We're working with organizations on assessments around return on investments, like what's the business case. We're helping leaders to show that we do work around inclusive product design. We do a lot of work now on equity communications and messaging because the language has been forced to change, and so we're helping organizations with that. And we provide leadership as well. So a lot of great things. You can find us at www.advancingequity.com. We also have a 501c3. So we work with a lot of foundations doing this work as well in community groups. And so I'm personally on LinkedIn, advancing these also on LinkedIn. I'm on Instagram for more like personal content, but it's a public page. I'm on X, Twitter. I used to have a huge following on there. I don't post as much just because it's blue sky. So I'm everywhere. And, my personal website is www.ucheBlackstock.com. Hopefully, we'll have a second book coming out in the next year or two that is actually quite different from Legacy, something that's positive energy.
Well, that's awesome. And we'll put those links in the show notes. And when you do get ready for that next book, let me know, and maybe we'll bring you on the show again, and we can talk a little bit more about that. Well, good. Well, Uché, it's been a pleasure talking to you. I know I get to shake your hand and say hi for 3 seconds at Health, but I've known of you. I've seen you on the Worthy 100 and the MM&M, I think top 30, marketing or healthcare influencers and many other lists. So thank you for doing what you do. It's a pleasure to have this conversation, and I wish you nothing but the best.
Thank you so much. This is one of my most fun conversations. Thank you for the thoughtful questions and the engagement. And this was a lot of fun. Thank you.
Well, music to my ears. Thank you.